And these individuals, they actually had better results than if they were taking Mounjaro or if they were taking Ozempic or Wegovy or any of these GLP-1s. 12 weeks, they were able to lose. So this was individuals who are, morbidly obese, which is a term that sounds like from our discussion earlier is going to be going away at some point. But basically what that means is someone is at least 100 pounds overweight or their BMI is over 40 for right now. And these individuals, they actually had better results than if they were taking Mounjaro or if they were taking Ozempic or Wegovy or any of these GLP-1s. 12 weeks, they were able to lose 15 kilograms of fat mass, which is well over 30 pounds of body fat. And they lost 0 lean body mass. So they weren't starting in a particularly great place, but they were on a higher protein, very low calorie diet, 1,120 calories. So these people probably didn't feel great, but if you're morbidly obese, you probably don't feel great to begin with. So I would say by the end of this 12-week period, they probably felt substantially better. They probably were quite hungry, but they did substantially improve their health in a short amount of time. And of course, this was done with medical supervision, and not clear what method of body composition was used. But when you have someone in this situation, it's less important whether they're getting a DEXA or if they're using bioimpedance, because it's going to get you in the ballpark.
Yep.
And when you're on an extreme like this, you're susceptible to overestimating the amount of body fat or underestimating the amount of body fat. So, do your resistance training, get protein in, adjust the calories, and it really depends on someone's starting point. Do I think someone who's already at 10% body fat could do the same thing? Probably not, because your body is, the leaner you get, the harder it is to hold on to that lean body mass. And there's a lot of variation from person to person. So one person may be able to hold quite a bit of lean mass at 10%. Someone else may have a hard time maintaining or adding any more lean body mass if they're at 10% body fat.
Yeah, I think those are great takeaways. Another takeaway is GLP-1s, including semaglutide or tirzepatide, are not evil. They are just tools, and they do very closely mimic the loss in lean body mass that's achieved by very low calorie diets. They essentially enable VLCDs to be done more easily. It's also well known among the obesity medicine community that VLCDs should be physician supervised at a clinic with knowledgeable providers. And I think that could make the case that if you're on a VLCD with a GLP-1, shouldn't that also be supervised by knowledgeable providers? For example, perhaps not at clinics which are exclusively med spas. Not that obviously we do aesthetics and we do obesity medicine as well, but I just think it's a good example that a lot of the questions and the criticisms of GLP-1s that are rightfully brought up could be, you can say the exact same thing about any VLCD.
Yeah, and I would argue that you have the potential for less side effects on a VLCD, which med spas don't seem to be prescribing VLCDs to people.
Why is that?
But for whatever reason that may be, like a VLCD is probably safer than handing someone a syringe of semaglutide and then see you in 3 months. So
yeah, is that 0.01 or 0.1?
Doesn't matter. Watch a YouTube video. Yeah, there was a study we may talk about, secret shoppers, going in, and one of the topics was like, how are these people being trained on injection technique when they're prescribed injectable medications? And in almost every case, it was a YouTube video. So it's something that we may cover more in the future. I suspect it's probably a similar process for med spas where time is money.
Yeah, efficiency can be a good thing, and it can also be detrimental. So even though we are an individualized medicine clinic, and we say individualized all the time in our podcast episodes and in our patient visits, having some structure to the program can be helpful. And depending on what you need, just keep in mind that medications and supplements and peptides, which are just really medications, they are just tools to help you achieve a goal. And if you're not concurrently making a lifestyle intervention to make that sustainable, to get away from the pit of quicksand, then just having a crane like semaglutide pull you out of the quicksand and then drop you back off when you stop paying your monthly fee, that you're just going to sink right back
Might
in.
hit that quicksand harder and sink faster.
Yeah. And be demoralized. So it's like pharmacologically induced yo-yo dieting.
Which is why people should just take them forever, is the messaging that I'm hearing in obesity medicine.
Yeah. And at the same time, they are one of our favorite tools. We're definitely not in the camp that everybody should take them forever. There's a lot of individuals with diabetes that probably will be well served taking them forever, partly just to keep them off insulin, but everybody's at a different spot. So yeah, hopefully that's a nice little tangent into GLP-1s.